Hello everyone, my name is Zhongxin. I'm the medical head of NHēt China. It's my great pleasure today here to share with you the skin management guideline for post-procedures. And on behalf of Professor Tian, I'm going to share with you her part. As you know, due to the latest new COVID-19 cases in Beijing, we couldn't send the video recording crew to the hospital. Therefore, I would like to speak on behalf of Professor Tian Yan, the co-author of this guideline. I'm going to share with you the content. We are glad to see the new trend that the procedures has been widely used globally by dermatologists, not only for treating the skin diseases like acne, pigmentation disorder, and also for anti-aging purposes and rejuvenation purposes nowadays. And this also leads to a new problem, which is the skin scars. And we are really concerned about this part. And for the procedures, we have two categories. The first one is aesthetic procedure, mainly for beautification, rejuvenation, and anti-aging purposes. For this kind of procedure, the risk of scars are manageable because it's minimal level under control by the device and also under control by the doctors. However, for the medical procedures, like the surgical operations, the main purpose is for the efficacy of clinical treatment, and the scar is quite inevitable. Therefore, the management becomes really essential for the patients. And data shows every year we have 100 million patients who are suffering from the scars due to the medical procedure. And they also suffer from the pain, tightness, itchiness, and dryness after the procedures. This should be brought to our attention. And besides the immediate health impact, the scars also lead to a life quality impact as well. Data shows that for the patients suffering from scars, they also suffer from a life quality impact, such as 28 times of sexual life, 7 times more of body movements, and 5 times more of embarrassment. And therefore, we can see that the scars has both impact on the physical health and also the mental health. That has an urgent need to be managed by us together. And due to this great need, we have published the International Skin Management Guideline because we have realized the importance of scar management and skincare management after the procedure. We have co-authored together with the global dermatological expert to publish this international guideline on scar management. It's really essential to manage the scars during the skin healing phase. Moreover, when we interview surgeons, like I was one of them, that the surgeon's main concern is to prevent infections after the procedure, after operations. They just make sure that the wound is clean and clear and no infection, and the job is done at the time of normally 2 or maximum 3 weeks after the procedure. However, the skin healing process just started at its phase, but is no longer managed by the doctors. Instead, it's managed by the Mother Nature, which is not right. We want to change this situation. We want to advocate for all doctors, surgeons, physicians to come together and join us to manage the scar with a better approach. Therefore, we published the International Scar Management Guideline, not only to cover the during procedure phase, but also pre and post, with a clear guidance about the product we used and a skincare routine, as well as the combination of different approaches. As we have already categorized the procedure into 2 parts, the non-surgical and the surgical ones. Let me give you more details. For non-surgical procedures, the most commonly used ones are the laser treatment and also the chemical peelings. And for laser, we have ablasive laser and also non-ablasive laser. For chemical peelings, we have superficial peeling and a deep peeling. And you can see the similarity between the superficial peeling and the non-ablasive laser, and also the similarity between the ablasive laser and deep chemical peelings. For the superficial ones, the skin barrier damage is controllable, it's minimal. We just need to intensify the anti-UV skincare and also use the gentle cleanser as well as the skin barrier repairing cream. And this can accelerate the skin repairing. And for the deep chemical peeling and ablasive laser, we need to be aware of the bleeding risk, of the edema risk, and also related side effects. And for surgical procedures such as the thread or combined surgeries or even skin grafts, this is more complex than those non-surgical procedures, and they may lead to more severe side effects, and they also take much longer time for skin healings. And all the details can be found in the International Skincare Guideline. We give all the details of the products and skincare routines as well as the highlights. And once more, I'm very glad to speak on behalf of Professor Tian, and I wish you all enjoy this guideline, and we wish that we can have an offline event very soon. Today I'm going to share with you 2 clinical study results. One is for the non-abrasive laser, the other is for carbon dioxide abrasive laser peeling. The first study is using Zika plus B5 boom cream after the procedure of non-abrasive laser. A total of 30 subjects has been enrolled for the study, and all of them has been through the non-abrasive laser 1565 nanometer of treatment. And then 20 subjects were using the Zika plus B5 boom cream after procedure, and 10 subjects were using the sodium chloride solution with 0.9% as control group. And both groups went through the laser, and after the laser, they were evaluated on the first day, third day, the fifth day, and the seventh day. Evaluation included the visual analog scale of the pain, transepidermal water loss, and subjective scoring of the skin feelings. The study has been published on a Chinese local journal. And we take a look at the charts of the study results. As you can see here on the left-hand side, the red line represents the P5 group, and the blue line represents the sodium chloride group as control. This is for transepidermal water loss. Before the laser and after the laser for day 1, both evaluation points of the transepidermal water loss were similar. But from day 3 onwards, we can see a clear difference of the transepidermal water loss, showing the red curve is under the blue curve, that the Zika plus B5 boom cream can help repair the skin barrier much faster. On the right-hand side, you see the moisturization level, and for this one, we can see a significant difference already existing at the day 1, and then day 3, and day 5, and day 7, after the non-abrasive laser, if we use the Zika plus B5 boom cream, which is showing that this product can significantly improve the skin barrier damage repairing after the non-abrasive laser treatment. And moreover, let's take a look at the photos after the procedure. For these subjects, which is using the Zika plus B5 boom cream, as you can see, before the laser, the skin is normal. After laser, you can see there are many red dots indicating the inflammation on the skin. And then day 1 and day 3 and day 7, we can see significant and very visible differences of the skin repairing process, indicating that the B5 cream can help to boost acceleration of the skin repairing. However, this study, we were comparing the Zika plus B5 boom cream versus a control group that is empty control, using only the sodium chloride solution. So we use this study as the reference, has designed another study, and this time is a randomized control trial, and it was using on the carbon dioxide, and this time it was using the Zika plus B5 boom cream on carbon dioxide laser peeling procedure, which is a very heavy procedure, and it caused the whole level of the skin barrier damage. Let's go to the second study. And this study, we were using the randomized control trial methodology. We enrolled totally 45 subjects. Every subject was comparing the left face versus the right face. And they were using the left and the right face with two different types of products. One is the Zika plus B5 boom cream. The other is the standard prescription drug treatment as a local manufactured product. And both groups went through the baseline evaluations, and after laser, they were evaluated at 30 minutes. And then they went back home and returned to the hospital on the 3rd day, and then the 7th day, and then the 28th day. So totally there were 4 time points for the evaluations, including the visual analog scale of pain, transepidermal water loss, and erythema index, as well as the pigmentation index. The study results has been published on the global journal Dermatological Therapy. And let me share with you the results as follows. As you can see in this chart, comparing with the control group and the study group, which is using the prescription drug as Rx showed on the table, and also Zika plus B5 on the table, we can see the transepidermal water loss. For the baseline, the T-wall of two groups were very similar. And then on day 3, we do not see a significant difference, but from the mean value, you can already see there is a difference, but without a significance. And on day 7, with the T-wall value as 16.7 for the prescription drug group, for the Zika plus B5 group is only 14.72. Now we see a signal for these valuations on day 7, which meaning the skin barrier repairing on day 7 for the Zika plus B5 is much faster than the prescription drug as standard treatment. And on day 28, it becomes very similar again, which meaning still that for 1 month of the skin repairing phase, the prescription drug is similar to the Zika plus B5 boom cream. And the second table showing the erythema index. Erythema indicates the level of inflammation after the laser procedure. Because for this study, we were using the carbon dioxide laser procedure, which can cause a really severe level of inflammation on the face, on the skin. And erythema index, we can see the two signal on day 3 and day 7. For day 3, the standard treatment prescription drug group, it is 343.59. But for the TICA plus B5, we see only 300. And here we got a very big difference with a significance level. And also on day 7, we see a significant difference between the two groups as well, which indicates that the TICA plus B5 boom cream can accelerate the skin barrier repairing from day 3 till day 7 with a significant superiority to the group using the standard treatment of prescription drug. And moreover, if we count the days of the skin scalp removal, which meaning after the laser peeling, you got some scalp on the face, and those scalp will be removed or fall off naturally. We count the days from the procedure to the time where the scalp is removed from the face. And then we do the average of this days value. We realized for the side, left or right side of the face that we're using the prescription drug, it will take 6.14 days for the scalp removal. However, if we use the TICA plus B5 boom cream, this date can be shortened to 5.14 days. This is a 20% difference, which meaning the healing process can be accelerated by 20% if you use the TICA plus B5 boom cream compared with the standard treatment using a prescription drug. And moreover, we can see the photos of this study, which can be even more visible difference. Take a look. Just to let you know that all the subjects have signed the informed consent form, allow us to showing their photo for academic exchange purposes. And here you see on the upper level, this is the side of the face where the standard prescription drug has been applied. And on the lower side, you see the side of the face that we're using the TICA plus B5 boom cream. And this is the same person with left or right side face using two types of products as a comparison. And every subject has been randomized with either the left or the right face using different type of products. So the first column you see is the pre-procedure face. The both sides looks very similar. And then after laser procedure, at half an hour, we can see both sides with a lot of red dots showing the severe inflammation on the face. And then after 3 days, this is where you can see a very clear difference of the face. So on the side of the face, for this case, is the right side. You can see that the skin has a much less inflammation, much less erythema index, comparing to the side where they use the standard treatment group of the prescription drug. And this difference is still visible on day 7. So this is corresponding to the previous table we saw on the day 3 and the day 7 using TICA plus B5 boom cream versus using a prescription drug. And finally, on day 28, we can see the both sides become very similar. So that shows the overall efficacy of the two products are comparable. Last but not least, let's take a look that this study result, as I already said, has been published on Dermatological Therapy Journal, which is a global journal. And we're very happy about these results. This one is a strong endorsement of the efficacy as well as the safety of the TICA plus B5 boom cream on the carbon dioxide abrasive laser treatment. Thank you very much.
Well, hello. I'm Professor Andrew Alexis, a dermatologist in New York City, and it's my pleasure today to speak about performing cosmetic procedures in darker skin phototypes. Now, this segment of the population with richly pigmented skin or skin of color, ethnic skin as it's sometimes called, represents an increasing proportion of the cosmetic procedures that are being performed. When we look at the United States population and all of the cosmetic procedures that are being performed, the proportion of the procedures being performed on the various non-white racial ethnic groups is roughly 1/3. And this represents a significant increase over the past decade, and we anticipate continued increases in that regard. As our technologies become safer and more appropriate for diverse skin types, and as demographic shifts increase the proportion of patients with non-white racial ethnic populations in many parts of the world where we practice. So when we look at the leading procedures that are being performed in patients with skin of color or richly pigmented skin, includes chemical peels, superficial peeling agents in particular, removal of benign lesions such as dermatosis papulosa nigra, laser hair removal, non-ablative lasers, as well as injectable fillers and neuromodulators. Now, the key is that there are higher risks of pigmentary and scarring complications when performing cosmetic procedures in richly pigmented skin types. And so we have to strike this delicate balance between the controlled injury associated with the cosmetic procedure and the risk of pigment alteration or worse still, scarring. When this balance is not optimized, unfortunately, long-term disfiguring complications can occur. So the key to minimizing and treating pigmentary complications starts with prevention, but also very early intervention to treat any signs of hyperpigmentation or hypopigmentation that might arise from some procedures. So what are the things that we should keep in mind? Number one, it's absolutely paramount to be very familiar with the effects of any device that one uses and to perform test spots before proceeding with full-on treatments in patients with skin of color. So making sure that you're fully familiar with the broad range of effects at different settings. Knowing your patient is very important. We don't want to assume the ancestry of the patient or make assumptions as to how the skin will respond just by looking at the sun-exposed skin. As an example, these three individuals who have similar degrees of pigmentation of facial skin come from three completely different parts of the world and have completely different genetics and may have different risks of hyperpigmentation and scarring. So know your patient. Don't assume. Ask about their ancestry. Ask about their response to sun to accurately obtain their phototype. Ask and examine the skin for any signs of sequelae from injury or inflammation, and examine and ask the patient about any history of keloids and hypertrophic scars. One recently described approach to predicting the risk of post-inflammatory hyperpigmentation following procedures is one described by Hector Leal Silva in Mexico, which involves looking at the creases of the palm and assessing the degree of pigment difference between the pigment in the palmar crease and the surrounding skin. The greater the contrast, the greater the potential risk for post-inflammatory hyperpigmentation. So this may serve as a very useful practical tool to better predict post-inflammatory hyperpigmentation. Third is to prevent complications, thinking about preventative treatment regimens, most notably sun protection and sunscreen specifically can be helpful and have been shown to reduce the risk of post-inflammatory hyperpigmentation following certain procedures, such as this nice study from Thailand showing the importance of and efficacy of using sunscreen immediately post-procedure, starting on day one. And you can see that in the red line, which represents the melanin index in the side of the face where sunscreen was used, from day one, we see a lower degree of pigmentation than in the control group where sunscreen was not used until the day 8. An example here with the control at the top and over here at the bottom, the sunscreen side of the face where there's less pigmentation following fractional laser. When it comes to sunscreens in richly pigmented skin types, finding that optimal sunscreen that is also cosmetically acceptable to the patient and blends in well with the patient's natural skin color is extremely important, and it can be a bit of a challenge. But involving the patient in the decision, allowing them to sample different ones to ensure that they're comfortable is a good approach to getting that adherence and satisfaction that we're looking for. Fourth is recognizing differences in preferred treatment options and parameters for richly pigmented skin, with the key goal of minimizing epidermal and dermal injury. So thinking very carefully about the parameters and which specific procedures would be appropriate. For chemical peels, this is the superficial peeling agents, including glycolic, salicylic acid. For laser hair removal, longer wavelengths such as the 1064 Nd:YAG are preferred. For laser resurfacing, non-ablative technologies, including non-ablative fractional with low density. And with injectable fillers and neuromodulators, these can be done safely in all skin types. Now, when treatment doesn't go as planned and there is hyperpigmentation, we do have strategies to reduce the pigmentation by inhibiting tyrosinase, inhibiting the transfer of melanosomes to the keratinocyte, downregulating the expression of and activity of tyrosinase, and minimizing external stimuli using agents such as anti-inflammatory agents and antioxidant agents to reduce inflammatory processes that drive hyperpigmentation. Adjunctive skincare really plays a key role in the whole approach to best outcomes in cosmetic procedures in skin of color, from sun protection pre and post procedure, skin lightening topicals, which are helpful pre and post procedure, anti-inflammatory agents, and topicals that help to promote wound healing or barrier repair. And as pigmentary issues, when they do occur, take some time to resolve, cover-up cosmetics may also be very useful as an adjunct. So with that, it's my pleasure to introduce Anne-Laure, who will discuss, pick up on my discussion and discuss a product that is useful for wound healing and scars. Thank you.
Good morning. I'm Anne-Laure de Messin, and I'm in charge of the scientific communication for Laroche-Posay. In a recent epidemiological study conducted by Laroche-Posay, we found that surgeons, after a medical or aesthetic procedure, poorly prescribe a dermocosmetic management. Healing creams are advised to less than 25% of patients, and sun protection for less than 5% of patients. Nevertheless, as we previously saw in this workshop, this skincare management is key to avoid scars. More than 10 studies have been conducted on Cicaplast. Clinical studies, as well as observational studies, have demonstrated its efficacy in 21 different skin indications, such as after aesthetic procedure, for example, peeling, laser, cryotherapy, but it has also proven its efficacy post-tattoo, post-stitches, or after superficial burns. The main short-term symptoms of scars experienced by the patients are mainly pains during or out of cares, but also redness and itchiness that are described by patients as the main burden of scars. Thanks to Cicaplast, pain is reduced by 90%. Erythema, desquamation, and cracks are significantly decreased in 15 days. Pain and redness are also the main triggers of scars that impact the quality of life of patients. And because healing is always a too long process for patients who suffer, Cicaplast improved the reepithelialization to reduce the duration of healing by 7 days versus control groups. It also decreases redness and inflammation for better skin comfort during healing. As a sum up, Cicaplast Balm B5 is a complete skincare solution to boost healing and reduce inflammation for better scarring. It contains madecassoside, which is an extract of Centella asiatica with anti-inflammatory properties. Madecassoside also helps keratinocytes migration to boost reepithelialization. It also contains 5% of panthenol to soothe inflammation and repair skin barrier. We also added shea butter and glycerin to improve hydration for better comfort and skin elasticity, and copper and zinc for their antibacterial action as well as their healing properties. This whole mix of ingredients allows the dermatological management of scars to improve patients' quality of life. Thank you for attending this workshop session with Laroche-Posay.